name is Christina Johnson, and I currently work with oncology patients who receive chemotherapy and or radiation therapy. I'm going to present to you today the importance of not only nutrition, but nutritional counseling throughout their treatments, not just in the beginning. My goal here is to educate you, the new oncology nurses, about the side effects of these treatments, and then we'll explain why nutrition is important. Let's take a look at our objectives. So we're going to talk about the importance of nutrition and how to maintain it. We'll talk about side effects that lead a patient to malnutrition and explain some of the negative effects of malnutrition and solutions. So healthy eating. Research has shown that if a patient eats healthy prior to beginning chemotherapy and throughout chemotherapy, they're able to tolerate their side effects, if not even alleviate some of those side effects. Healthy eating helps the patient to maintain strength, endurance, and weight. And if a patient can maintain all three of these, they have a better chance of completing their treatments. Healthy eating also helps to prevent nutrient deficiencies, and also healthy eating requires high caloric intake and protein intake. Let's talk about some of the side effects of these treatments. We'll start with radiation. One of the side effects of radiation is esophagitis, which is the inflammation of the esophagus. This can be very painful for the patient, and this could also be one of the side effects that affects the amount of intake that the patient takes in as food. I'm going to skip down to dysphagia, which is the difficulty in swallowing. So if a patient has esophagitis and then also has difficulty in swallowing, this is going to affect the amount of food that they take in, which will lead to weight loss and anorexia. I've listed some side effects, not all, listed some side effects of chemotherapy, the ones that will affect the patient's nutritional outcome. So nausea being the first one affects a lot of patients going through chemotherapy. I know when I'm nauseated, and you too as well, you're nauseated, you don't feel like taking in any food. And when patients have vomiting, of course they're losing their food and their fluids, and that can be a nutritional issue. I'm going to throw diarrhea in there as well. The patient having vomiting and diarrhea is at risk for dehydration and will at least need IV fluids on an inpatient basis or outpatient basis to restore their fluids. Chemotherapy also causes decreased appetite in the patient. That causes them to take in less food. Patients also on treatment with chemotherapy complain of altered tastes in their food, sometimes a metallic taste to their food, also a dry mouth. And these two symptoms can make it more difficult for the patient to take in foods and eat. And of course, chemotherapy can cause the patient, for the reasons we've talked about, weight loss. So how do patients respond to treatment? Well, it affects their strength and their endurance. It can make them very fatigued. It can make them have a decrease in motivation. Things that they once enjoyed doing, going out shopping, doing chores around the house, may be more difficult for them once they begin treatment. And then 50 to 80% of patients who do experience malnutrition can develop what's called cachexia, which is the wasting away of the body due to chronic disease. Patients also can get to a point where treatment has to be interrupted or stopped because they cannot tolerate their side effects any longer. And this can definitely affect their prognosis. The other ways that treatment affects the patients, if they become sick with these side effects, they could be hospitalized. It could cause lengthy hospital stays. A patient taking chemotherapy is at risk for infection because chemotherapy does kill their germ fighters, their white blood cells. So the patient can become neutropenic. They're at risk for infection at that point, and then of course that puts them at risk for sepsis and even death. Chemotherapy is also responsible for causing the patient a delay in healing. And like I said before, if the chemotherapy has to be stopped stopping treatment could overall affect the patient's survival rate. So let's talk about some solutions that we as the chemo-oncology nurses can offer the patient. We can incorporate nutritional counseling and education before the patient starts chemotherapy and continue that throughout their treatment. We can do this also with the help of their family members. We want to encourage the family members to come to the visit with them, to be able to listen to what we discuss and counsel the patients about nutrition. Family members are key, caregivers. They're key players in this because the patients don't always hear what we say. They don't always remember what we say. That might be due to they don't feel good or their anxiety levels are high. So by bringing the family members with them on their visits, they sometimes will remember a lot more than what the patient did and can reiterate this at home for the patient. What we want to do is schedule interval meetings with the patients during their treatment. If a patient comes in every 3 weeks, we want to meet with them each time they come in, talk about things with them about their diet. We want to evaluate their weight, their nutritional intake, and their side effects and how well they're tolerating treatment. It's a good idea to encourage your patients and their caregivers to keep food diaries and to bring to these visits as well so that we can discuss the intake that they have with their food and just how well they're doing with it. So, in conclusion, it is important that a focus be placed on nutrition throughout treatment. And the goal here is to provide nutritional counseling and education and help monitor the patients for signs of compromise so they can be corrected so that the patient can benefit from their treatment and increase their survival rate. Thank you. That's the end of my presentation.